Thank you and welcome to this segment of our show. I'm joined now with Miss Geraldine Clark. And Geraldine, it's really good to be able to have an opportunity to work in this capacity with you once again. And I think that our relationship is going to become more strengthened when we begin to get into the area of doing outreach with this communications effort. And today we're going to be doing a joint conversation with two distinguished individuals who are members of the staff at the New Jersey Medical School. To have the two individuals that are here with us today is something that brings a lot of inspiration to the extent that they would feel comfortable in working with us in this capacity. We're here with now Mr. Jacob Lindenthal and Mr. Mark Graybow. The two of them have been very instrumental in creating an environment for young people to learn the medical profession through an institute that has been developed through UMDNJ. And Dr. Lindenthal is the institute's founder and someone who has a passion for doing outreach in the urban community in particular and helping to establish ways in which we can educate the future generation of medical professionals to know just how involved that particular responsibility of career may be. Dr. Lindenthal, thank you very much for participating with us.
Pleasure to be here.
Dr. Graybow has been part of the outreach effort in the Institute and certainly has been a very instrumental part of seeing the success of how it has been able to be the accomplished vehicle towards helping medical professionals today be able to become part of the mainstream of that particular profession. And thank you, Mr. Graybow, for also being a part of our presentation. Dr. Lindenthal, I think that it's really important that we share with our audience the value that you have brought to our community and why it has sustained as well as it has.
Well, we're very committed at the New Jersey Medical School to reaching out to the community. We have many programs, not only that are run by our staff, our professors, our clinicians, but we also have many programs that our medical students are involved in which we do very many things in behalf of the health of the community. And our program, or programs I should say, are just one of a whole series of what we think are very valuable programs in which we try to teach people about health and medicine and introduce people to our wonderful medical school, the New Jersey Medical School, here in Newark.
Not only that, in addition to the introduction piece, you really have a very large array of professionals that have been able to inspire and even give a sense of comfort. And the kind of program that you have introduced has been very helpful in establishing that kind of comfort. Mm-hmm. The medical profession can be intimidating.
Yes, it can.
And in regard to what substantiates its credibility is the way in which individuals are taught. Why is the Institute such a favorite in regard to students who want to learn more about being a medical professional?
Well, as you probably can surmise, to be a physician, you really have to be an effective communicator. You really are an educator. You're a motivator. You have to get people to comply with their medications. You've got to get people to understand their own symptoms. They have to know their own bodies very as much as possible. And so insofar as we can have our medical students interact with the public as early in their educational careers as possible, the better it is for them, and the better it's going to be for their future patients.
All right, Geraldine.
So you encourage people to participate in these programs. How does a person find out about them? I mean, I know you're here on the show today, but how would someone, if I wasn't here today, how would I know about this program?
Probably by word of mouth. We open ourselves up, Mr. Graybaugh and myself. We are only too happy to be invited to various groups, and we actually promote the program in a variety of settings, whether they be churches or mosques or synagogues or civic groups. We have programs, for on tape, which allow us to give people a fairly good understanding of what they would be in for were they to apply to our program. But we don't do too much advertising. Unfortunately, we can only accommodate about 250 people per session, and that's because of our facilities, and there are fire laws, et cetera. So it's really on a first come, first served basis. Yes.
So you said word of mouth. So take it then that this is not your first year. This is.
Oh no. We will be beginning our 12th year with this mini med school. We've graduated over 6,000 people since the year 2000, and so many of the youngsters, of course, have gone on to medical careers in biomedical sciences, public health, dentistry, and many of the adults hopefully are extending their lives because of what they have learned in the program. Yes.
Yes, you mentioned that earlier, that part of what you're looking to do is to educate people, especially this particular program that you're doing, this segment, is geared towards older adults.
Correct.
And helping them to live longer and healthier lives.
Correct.
Could you talk a little bit more about that?
Yes. Everything that anyone can do to promote his or her health as early as possible in life will reap rewards later on. So if you diet and you exercise, let's say even at the age of 50 or 60, when you get to be 70 or 80 or beyond, you're more likely to be much healthier. So it's really an investment, and what we try to get people to understand is what is the nature of that investment. How can they invest in their most precious commodity, which is their bodies, of course. Yes.
Do you have anything to add?
I agree with Dr. Lindenthal. Our programs, I believe, are a tremendous benefit to the community. The pre-medical honors program, which is our high school program, as well as our adult mini-med school program, both serve the community very well, and we have graduates of our program who have gone on into healthcare careers, who actually have gone to medical school, dental school, nursing school, and the other allied health professions. And we also have a contingent of individuals who have benefited in terms of being educated in the healthcare issues that are pertinent today and the contemporary issues of healthcare, and they become better informed, very well informed from our program. So we've done, I believe, a tremendous service to the community.
So a person coming to your class does not have to have a healthcare background. They just have to have an interest in being healthy.
That's correct.
That's absolutely correct.
And then be able to use the skills
Yes,
that they
indeed.
learn and the knowledge in your program to continue their life or
Yes,
use it in
indeed.
another area.
I should say in this connection that we borrowed a mantra from a prominent clothier in the area, and we like to think that an educated patient is the doctor's best friend.
Okay.
So you see, the better you're able to communicate with your physician, the better that physician can assist you. And physicians like to talk to people who can talk back intelligently and give them ideas so that their work can be facilitated. And so today, we're limited in terms of the time that any physician can give to in any given
Right, I've
visit.
heard, yeah,
So you've
15
got
minutes,
to
less
you've
than
got to
15
have
minutes,
high
yeah.
impact, and so if you come in and you can explain your symptoms, why the physician can zero in that much more rapidly, and it becomes a much more efficient encounter.
Okay. So when you say you come and talk to people at different locations, I don't want to leave you out, but this is really fascinating. In my church, I told you I'm from Hudson County in West New York, so we do a health Sunday, and every one Sunday a month, we have a speaker come in and they talk about health issues like heart disease, breast cancer, whatever it may be. And we try to stay with the focus of what's happening that month because, like October is breast cancer awareness, so we tried to do a segment similar to that. Is that something that this program does, or is it something different?
Well, we certainly cover, a multitude of topics. I mean, clearly diabetes, breast cancer, but Mr. Graybow and I are only too happy to accommodate individual groups that would like to invite us, and what we do is we would then show you what our experience is like. In other words, this is what you can expect if you were to sign up to our mini-med school, and what are the requirements, and so people can right then decide, I really want to invest the time, because it is an investment in time. Look, there's a lot of effort, and there's plenty of entertainment on television, and plenty of sports, and plenty of things for people to do, so time is valuable, especially when you're getting older. But we think that it's really a great investment to come to us. We have a wonderful faculty at the New Jersey Medical School. I mean, they're very, very talented and very empathic, and we think it's a life-changing opportunity for people. And,
Is there homework?
no. However, I would say that the more you put into it, and if we give you readings, and we suggest that you do the readings. The more readings you do, and if you come, the following week, and you can ask our medical students, you can ask our professors to explain what's going on, we're only too happy to do so. I should point out that the level of the education is fairly high, because that's out of respect to the student. We don't dumb things down. We try to reach as high as possible, and then we try to pull as many people up with us as possible. And we have dozens of medical students who are there to assist anyone who is of interest. We're just looking for a person who has interest in the topic. We will do the rest. We will.
So basically, we just need to show up.
And stay awake.
And stay awake.
That's
Well, and what's really important, and Dr. Linenthal, is there is a degree of discipline for an individual who wants to get involved with the relationship that especially the medical profession offers. And, you're going to be able to be influenced greatly in the UMDNJ environment. Mr. Graybow, part of, and let's talk about it, because there's two programs that we're sharing with the viewers today that we want to really delve into as much time as we can get for it. Part of the pre-med program, which is the program that basically works with the high school student, gives an opportunity for incentives. Can you share with us exactly how an individual who would apply to be a part of it would benefit from those incentives?
Firstly, our pre-medical honors program, which will be starting next week on October 5th, is open to all high school students who have an interest in science and medicine. We have high school students from freshman year to senior year who come from all different high schools in the area, not restricted to Essex County, Bergen, Hudson, Passaic, and so on, northern New Jersey mostly, who basically know about us and want to participate in our program because we give them an opportunity of what it's like to be at a academic healthcare institution. And we've been doing this for a number of years, and our reputation has spread far and wide. And they know who we are, and they know the quality program that we do offer them. Now, these students get first-hand experience of what it's like to be at an academic healthcare institution. They sit in the lecture hall, which is used by the medical students earlier in the day, and they are in the same seats as the medical students are now in the evening hours or during the evening hours. These students, I can tell you, are extremely motivated students. They come to us motivated to succeed. They come to us motivated to get into the colleges and universities of their choice and to basically enter the healthcare field in some capacity. We have right now, as part of our medical student preceptors who run the program, we've actually had students who are at our medical school who were themselves part of the pre-medical honors program. We've had students go into medicine, dentistry, and all the other allied healthcare professions, whether it be nursing, physical therapy, clinical laboratory science, and so on. So we've had a tremendous impact on these students. Now, obviously, when they come to us, they're getting an intense 8-week enrichment program after hours. They've spent time in class all day at their respective high schools, and then they come to us in the evening to participate in this program, which runs basically from about 5:30 to 9 p.m. Now, they've put in a full day, obviously, but they've all basically told us that it's worth it to have gone through a program like this, to have been exposed to the stellar faculty that we have at the medical school and the resources we have at the medical school. These students then go on to college, and of course they put this experience that they've been exposed to in their college applications, and the admissions committees of the various colleges and universities take note of this kind of extracurricular activity, and it certainly benefits the students and indicates to the admissions committees of the various colleges and universities that these students are highly motivated, having seen that they've gone through this kind of program.
You should know that many of our students do not derive from college-educated families. And, very often, physicians' children become physicians and lawyers' children, etc. Our youngsters, very many of them, don't have the opportunity to role model. They don't have people they can actually figure out what this is all about. And so what we try to do is give these youngsters the opportunity to actually meet with, say hello to, talk with professors of medicine, professors of surgery. They would not normally have this opportunity, whereas other children, perhaps more advantaged youngsters, might have families who interact with people who are physicians, and therefore it's just commonplace for them. It's not commonplace for many, many of our youngsters, and we want to break down those barriers. And we want to get that youngster who's passionately interested in medicine. They just got to have the passion. And of course, you have to have the right type of mind to go into medicine. But if we can put these two together and identify these youngsters, and then also let youngsters who are not predisposed to these careers, they begin to understand that perhaps they should be looking elsewhere. So we're doing a service to both groups. We know that we're only going to reach a small proportion of the individuals who are ultimately going to come to our medical school or the other 125 in the nation.
Well, there is a major advantage in that regard in terms of the influence and an opportunity for exposure. And I think relative to the whole idea of the mini-med program, which is inspired to involve a number of members of our senior community, elders in particular, who may be interested in knowing more about the relationship that they have with their medical profession, but from a high level perspective. So the educational value from it can probably transcend into a number of different areas of outreach. But it is something that we are encouraged, We Care Partners, our organization, and Jerry's becoming a part of it so that we can do outreach in the central New Jersey location area. We'll be proud of helping to establish a way in which people understand how valuable these programs can be and to see what we can do to help expand it, because you really are limited right now.
Oh, yes. Oh, yes. We also, we're very interested in introducing people to our medical faculty and to our clinicians and to our outstanding hospital and clinical facilities. We really are first rate, and it's just another one of the secrets around here, what wonderful clinicians we really have, and we'd like to introduce people to them. And so my friend Michael takes people on hospital tours, and they get to see the laboratories, they get to see the trauma department, they get to see the emergency department. We have professors who give lectures in pathology where they can, if they want, they can see organs of the body, diseased organs. You can actually feel them if you wish, put them in your hand, and you see what a diseased heart may look like, or ovarian cancer or lung cancer. I mean, it's something to see. For example, a long-time smoker, what does it actually do to a lung? How does it differ from a non-smoker's lung? And so it is really a life-changing experience, and something that we hope will lead to increased health, because that's the business we're in.
And expanding the program, because it is a wonderful alternative to educational opportunities. And what we emphasize and want to be very supportive of are ways in which individuals can become more effectively able to be aware of the types of ways in which there are advantages available to us, especially here in New Jersey. We'd like to thank Dr. Lindenthal and Mr. Graybow for participating in this segment with us and sharing this very valuable program that they offer. If there's anyone who is interested in participating, Mr. Graybow, what's the best way for them to get information from it?
Well, first of all, they can certainly call me at any time. I can be reached at the medical school. My number is 973-972-1269 by phone. My email address is grabowmi, that's my last name and the first two letters of my first name, graybowmi @umdnj.edu. And thirdly, I could, or the person who's interested in any of our programs can certainly check out our website, the Pre-Medical Honors Program.
We really appreciate you establishing a relationship with us, and we're certainly going to be working very hard to make that effort something that's going to be very
nice.
helpful
Thank you.
in your efforts for outreach and making people aware of what's going on with your program.
Thank
Jerry,
you very much.
thank you very much again.
Thank
I
you.
really
I
appreciate it.
appreciate it a lot.
You being
Pleasure to
able
be
to
here.
step in and give me a little enjoyment. I have a great time with making sure that people are comfortable. And if you're interested in becoming a part of the We Care Partners or the Image Profile Report or any of the other entities that we offer here in Cablevision, please feel free to give us a call at 855-525-2273 or visit our website at www.wecarepartners.com.